I'm Dr. Freddy Gomez, and welcome back to Med Talk Health Talk, where caring is our calling. Obsessive-compulsive disorder is different for each person, but the OCD cycle usually looks the same once it is triggered. An obsession leads to anxiety, which then leads to compulsions, and this can become disruptive in a person's everyday life. Let's talk about the most disruptive form of OCD according to the National Institute of Mental Health, which are ruminations and intrusive thoughts. Dr. Joan, could you talk more about this?
For some cases of individuals with OCD, it's always, there can be that possibility that it's purely on obsessive thoughts. So there can be no compulsive behaviors associated with the thoughts. And as mentioned, these thoughts can be about aggression, thoughts about harming people. So these thoughts can lead to one feeling that anxiety, that fear that they may in fact hurt someone, they may hurt a loved one, they may hurt a family member. So for some, this can be very distressing because they do not, in fact, they do not like these thoughts, but these thoughts continue to come in, and thus the ruminative aspect of it.
Now, Dr. Joan, many might be listening to this and think, paano lang ba ang OCD sa pagiging meticuloso?
It's different because when we say meticuloso, perfectionistic, na? So perfectionism can be a part of our personality. So we need to make that clear distinction between an obsessive-compulsive personality type, which would include that being meticulous, perfectionistic, we want everything to be in order, versus the obsessive-compulsive disorder itself, which is again characterized by the presence of those very intrusive, unwanted thoughts which are anxiety-provoking, and then we do something to at least reduce the impact, the anxiety brought about by those thoughts.
Now, external factors might be triggering someone's obsessive-compulsive disorder. Jessica, could you talk about what are some of the possible triggers?
So some of the things that maintain OCD would be stress, stress that you get from the environment, work stress, school stress, family stress. There's also pandemic-related factors. Okay, so studies suggest that the COVID-19 pandemic has exacerbated OCD symptoms in individuals. Another trigger would be parental factors. So what do I mean by parental factors? In some situations, parents might model excessive washing or excessive checking, or at times they can participate in the checking behavior. So with the intention of reassuring the child, they might participate in checking, for example, the door if it's locked. So unfortunately, even though the parent has well intentions, this can reinforce the compulsions and the obsession.
Now, another common trigger or a possible trigger here is previous trauma. Dr. Joan, could you talk about this? How does a previous trauma, what type of previous trauma could be a risk factor for OCD?
Any form of traumatic life experience can possibly be a risk factor for the development of OCD, specifically trauma related to losses. We know that when we lose someone, and if it's sudden and we are not prepared for it, then it can elicit symptoms of grieving, depression, anxiety. And in fact, this example studies have shown that when we lose someone, when we lose something, be it real or imagined, it can have a profound effect on the risk of having symptoms of OCD. So it would, for example, if we lose someone from a disease, then it can make someone be more at risk to be more mindful of cleanliness. There can be fear of contamination. There can be fear about safety, security of loved ones, of family. And that's why, again, as many as 80% of those individuals who had experienced stressful and traumatic situations may be at risk for the development of OCD symptoms.
Now that we know the symptoms and triggers of obsessive-compulsive disorder, if you think you have OCD, especially if you have ruminations and intrusive thoughts, it is very important that you seek professional help. But only a trained medical and psychological professional can determine whether you have this disorder. Now, Dr. Joan, walk us through how OCD is diagnosed.
First, we do a very accurate and very thorough clinical examination in the clinic. We follow the Diagnostic and Statistical Manual of mental disorders. There is a criteria to be followed there in terms of assessing and diagnosing an individual to have OCD. So in the criteria, it says that there should be the presence of obsessions, obsessive thoughts, the ruminative thoughts are there, and or compulsive behaviors as a response or as a way to reduce the impact of the ruminative thoughts. And another criteria which is very important is that these behaviors or the time spent on ruminating on these thoughts is usually more than an hour. So it's time consuming. And because of this element of being time consuming, then it leads to that impact on the distressing impact on one's functionality. Because instead of being able to focus at work, go to work on time, attend classes on time, people with OCD may spend more hours at home to check and recheck, or maybe wash hands before they're able to go out and do the things or errands that they need to do. And we need to make sure that it's not due to another medical problem or another problem which may be triggered by a substance use or abuse.
Now, Miss Jessica, how is OCD naman determined if this is mild, moderate, or severe?
You can evaluate it in terms of how frequent it happens and in terms of the level of interference it has on one's work, school, or home functioning.
There's no cure for OCD today, but there are ways to keep it under control. More on this when we return. Your health is our mission here on MedTalk Health Talk. We'll be right back.
SMC, San Miguel Corporation. Bisag unsang industriya ang sudlan niini, tinguha sa SMC ang pag-uswag o paglambo sa mga Pilipino. Karon, gikan sa SMC, aniya na ang SMC Davao Cement. SMC Davao Cement. Gama sa Davao, para sa Mindanao. SMC Davao Cement. Ato ni Bay.
I'm Dr. Freddy Gomez and welcome back to MedTalk Health Talk. Obsessive compulsive disorder is a serious mental health condition that affects many children as well as adults. Now, coping with it can be challenging, but the disorder doesn't have to affect a person's quality of life. Dr. Joan, let's talk about management, treatments available for those with OCD.
So first, we have a psychopharmacology, like we have medications which can help with us to put the serotonin balance back. As mentioned earlier, there are problems with the secretion of neurotransmitters in the brain. So that's one. We address the levels of serotonin in the brain through medications. Another is behavioral therapy. So we have different therapies, and usually we combine pharmacologic and behavioral therapies. Studies have shown that this would be the perfect combination to achieve better control of the anxiety, better control of the situation, and it gives us the best results in the treatment and recovery of patients with OCD.
Now, Ms. Jessica, could you talk to us about the behavioral side? Let's talk about cognitive behavioral therapy. How does this work?
So there are two main camps, the CBT camp, cognitive behavioral therapy, and also mindfulness and acceptance commitment therapy. Okay, both of these interventions change how one thinks and behaves. For the CBT camp, a person's thinking is changed through cost-benefit analysis or determining if a belief is true or not true. Okay. For the mindfulness and ACT camp, the focus is actually not the content of the thought, but the process. Okay. So they view the individual with OCD as someone experiencing difficulty. Okay, and this is manifested by the obsessions and compulsions.
Now, Dr. Joan, when it comes to people like those, is OCD something that can be managed by oneself? If they learn certain coping mechanisms, is OCD something that people who find that they have some of the symptoms, should they try to manage it themselves?
For some, they have the symptoms persistently, and for some, I've had patients under my care who had these symptoms on an episodic basis because they've learned some coping strategies and techniques on how to handle the symptoms on their own. But of course, we always emphasize that family support is also very important because no one should go through this alone. When an individual admits or is aware that these are really very unwanted, irrational, illogical thoughts and behaviors, then family support also is very important. We need to be allies with the family because they are the ones who are with the individuals 24 hours a day, 7 days a week. So it's important for family members to be empathic, to understand that this is something that is really beyond the control of someone. It's, when we feel anxiety symptoms, there is a feeling that we've lost control over the situation. So the family member should be there to reassure, to encourage, and to always just support and to empathize and not be judgmental.
Now, while obsessive-compulsive disorder can be overwhelming at times, help is available for those dealing with the condition. So stay focused on your goals, have a good support system, and find a healthy outlet. Now, these are just some tips that can help you live a healthy and happy life. Thank you very much, psychiatrist Dr. Joan Perez Refarial and psychologist Ms. Jessica Espanto, for being with us today. We appreciate your time and your insights. I'm Dr. Freddy Gomez, and we'll see you again next time.